Hi there everybody, Dr. Steve here with Kinesi, and we are doing your Start Your Healing now for tennis elbow or a lateral epicondylalgia or lateral epicondylitis, which refers to pain in the outer elbow and usually affects a lot of gripping kinds of things. And so the first one we did some soft tissue massage, doing some self-massage, used one of the massager guns to kind of loosen up all of the tissue. And then we went into some pronation, supination, and hammering motions with the stick. So now we're going to go into some nerve gliding. The radial nerve is often a culprit in contributing to these elbow issues because it comes down out of the neck, down the back of the arm, and it goes through actually the supinator muscle here. And so that's a big part of why we want to loosen that one up, doing a lot of the pronation, supination, creating some blood flow to free up the nerve gliding and sliding in its little pathway. So we're going to take that up another little notch here, doing some nerve specific gliding for that radial nerve that comes down through the back. So the way that we're going to do the first one is we're going to bend the wrist back, and so this is kind of like getting the tip from behind you. Your back of the hand is pointed towards the ground, the palm is up, and then what we want to do is bring the arm up out to the side. A normal sensation is kind of a deep line of a stretch, but we don't want it to be a painful thing or feel like you're making fingers or hand go numb and tingly. So the wrist is bent back, the arm is coming out to the side to where you feel a good stretch. And then in that position, we want to try something with the head, which is tipping that ear towards that shoulder, and that's going to put the nerve on a little bit of slack up at the neck, where at the wrist it's still on tension. And then we're going to glide the nerve back and forth, doing this flossing motion where the head and the wrist do this little move dancing together. So when the wrist bends back, the head tips over to that side. When the wrist straightens, the head straightens. And so here we're doing this radial nerve gliding or flossing motion. And you would do 10 to say 15 of those. These are great to do when you first feel some sensations coming on and it's just starting to bug you. Jumping on this and doing the nerve gliding early is really helpful. So that's one way that we're going to do some of the nerve gliding and flossing. Now we're going to do a little radial nerve dance. So we start with the hand in the same position. We're going to bring it up out to the side, but what I want to do is I want to have you on the wall with your wrist. The back of the hand is on the wall so that your wrist is bent. So if we're kind of from the side view, or the front view, this is kind of what it looks like. The wrist is bent back so that the back of the hand is on the wall. That same side foot steps forward a little bit, and then all of this is in a tension position. We've got the nerve on stretch, and then we're going to take the hips and we're going to do a little wiggle from below. So now the nerve is in that stretch position, but we're getting the spine to move from below. We're doing some forward and back. We do some of the side to side with the hips, and then we do some twists, and you're kind of turning your body into it and away from the wall or that arm. So that's the indirect approach from the bottom. Then we're going to go more direct from the top, and we're going to do those same motions with the head. So in this position, we have the head going up and down. Then we're going to do ear to ear, tipping side to side. And then finally, we're going to do the rotation, turning, looking over each shoulder. So with the arm in that position, it's in a stretched nerve position. And then we created a lot of motion in the spine indirectly from the hips moving and kind of the bottom up approach. And then from a more direct neck specific approach, had the head doing all of those motions while we had that nerve in a stretched and lengthened position. So we have a couple of nerve gliding techniques to be able to add to the mix, and then be sure to stay tuned for part 3, where we'll go into something a little bit more dynamic to strengthen some of this area and get it feeling and functioning better for you. So until next time, keep moving, everybody.